Hello, I'm Robin Brumble, and I'm the Senior Director of Scientific Affairs at CLL Society. We are entering into our 4th year since the start of our research program, and we are excited to share that in this short span of time, we've already committed funding $1.7 million so far solely towards CLL and SLL research. Today, we're joined by our 2025 Integrative Medicine Award recipient, Dr. Nancy Musoke. We are extremely thankful to the many individual donors in our community who have made this award possible, and we are especially grateful to Big Young Singhal, who was instrumental in providing matching funds towards this particular research grant. The 2025 Integrative Medicine Award in CLL is aimed towards early exploration of research ideas that incorporate an integrative approach to addressing the many health challenges of those with the disease. And the goal of funding this type of research is to build a strong scientific evidence base to improve the quality of life for those living with CLL and SLL. So Dr. Musoke, at this time, I would like to first start off by saying congratulations. And if you could please tell us a little about yourself and maybe provide a brief overview of how you got to this point in your career.
Thank you so much, Robin. Thank you for the introduction, and thank you so much to everyone in the CLL Society for making this possible for our patients. We really appreciate it. So as you said, my name is Nancy Musoke. I'm a second-year hematology oncology fellow. I'm currently at the Cleveland Clinic Foundation Taussig Cancer Center, and I will be transitioning to my third year of fellowship in a few weeks. Throughout my early medicine training during residency, I gained interest into malignant hematology, and I did my residency at Albert Einstein Medical Center in Philadelphia. And throughout the years, my interests have evolved, and more so now, I'm even more interested in lymphoid malignancies, with a special interest in CAR T cell therapy as well. I hope to pursue these interests as my career continues to grow, and I hope to be lymphoma focused moving forward.
Great. Well, your research project is called Curcumin, Exercise, and Placebo Effects on CLL Progression and Immune Function. So first, it might be helpful to talk a little bit about what curcumin is and why it was of interest to you.
Yes. So a lot of people may not know what curcumin is, but a lot more people may have heard of turmeric or turmeric, which is the yellow spice extract compound that's commonly used in cuisines across the world. But actually, interestingly, over very many centuries, it's been used in lots of traditional and integrative medicine practices. So curcumin is a bioactive compound of turmeric. So 75% of this ground yellow extract powder is composed of curcumin. And how I came about being involved with this is that I've been very fortunate here at the Cleveland Clinic to work under the mentorship of Dr. Allison Winter, who's one of our lymphoma experts. And so she's really been instrumental in guiding and directing the next steps in studying this further.
That's great. Well, what are some of the current challenges that healthcare providers like you and researchers face when it comes to understanding integrative therapies and approaches to managing CLL and SLL? Because we know that that's a really common question amongst our patients. Is there anything I can do that's not medication to help my disease? So talk a little bit about that.
That's a great question. I think some of the challenges as it pertains to integrative therapies is that there's just not enough information out there that providers feel comfortable validating or sharing. And so more studies are needed. And it is a very difficult situation, as you mentioned. Patients with CLL, particularly if they're in the early stages of their CLL diagnosis, are often designated to a watch and wait period, which is this period, this phase where they're observed, they're monitored with labs and physical examinations, but they're not initiated on treatment because currently, per guidelines, they don't meet criteria to initiate treatment. So as one can imagine, this is a very daunting sort of period. It can be anxiety provoking. It can be unsettling for a lot of patients who feel that they should be doing more, that they want to do more, but they don't necessarily know what to do.
Mhm. Yeah, and we find often there's a lot of of information out there that may not be very reliable. So you're right. That's one of the reasons we wanted this grant to happen so that we can get some good scientific evidence to support some of the things we're looking at. So we're really glad that you're doing that. So that being said, maybe let's go a little bit deeper into the research project itself. Can you talk about what exactly you're going to be measuring with this research project? Maybe briefly touch on like the methodologies or how you're going to be doing it.
So the patients that we're hoping to enroll into this study are patients with early stage CLL who have not met any treatment indication criteria and at this stage have minimal to no symptoms from their CLL. These patients will be enrolled into the study and they'll be randomized either to receive curcumin daily or placebo daily. They'll take this daily pill. And at the 3-month mark, we're going to add in monitoring for physical activity using a pedometer. At the 6-month mark, the study is going to end and we're going to assess all the information. Monthly, patients are going to come into clinic and get evaluated and get assessed. Lab work will be done monthly to sort of assess the disease of CLL. We're also going to be doing some research-based lab work to get a better sense of the immune function. There has been a lot of preclinical data that has shown anti-cancer potential properties of curcumin, which is why we thought it would be a good supplement to use for this study. Similarly, there's been recent emerging preclinical data as well that has shown that exercise can potentially positively influence the tumor microenvironment or the immune state in patients, therefore favoring them to have less rapid progression of their CLL is what we postulate. So the idea is to sort of use this study to combine and explore the outcomes for these patients.
Great. And just one thing you said was pedometer. I think most people know what that is, but could you just kind of mention why you're using that?
Exercise is very widely recommended among patients with cancer, particularly in CLL. However, sometimes it's hard to gauge physical activity as different modalities are used for exercise. A pedometer is a step tracking device that we will be using to get a sense of how many steps patients are getting each day.
Perfect. That's great. So, all right. Well, very interesting study that you're going to be doing. Well, do you have any real hopes of what you want to accomplish as a result of what you might learn from your research?
Yes, I think one other thing I will mention is that we do hope to track, give patients questionnaires throughout the study about their quality of life. And so this is important for us to get a sense of things that improve and enhance patients' quality of life. There have been recent studies in CLL that have postulated that exercise has led to an improvement in the lymphoma-related symptoms. So we're hoping to definitely get some more information about this. I think the bigger and broader hope is to sort of bridge this gap of understanding in terms of what patients are commonly already doing, whether it's exercise or taking supplements, and bridge that gap with the providers to be able to provide evidence-based advice and enhance the decision-making in the clinic.
Wonderful. Well, do you have any final thoughts that you would like to add as we close?
Um, just that I think this is a overall low risk intervention study and a great opportunity both for patients and providers to participate in, and really grateful for the CLL Society for providing this opportunity.
We're thankful for you for doing the work. So, well, Dr. Musoke, on behalf of CLL Society, I would like to thank you and your colleagues for all the work that you're doing to advance the field in this very important area of research for CLL and SLL. So, integrative approaches for those living with the disease are truly an unmet need that, as we've talked about, not enough research dollars are being put towards. And without grants like this and researchers like you, it's very difficult to understand the science and gather the valid evidence when it comes to the effects of integrative approaches. So at we at CLL Society, and I know those in our community, are eager to learn about your future findings, and we are very excited about your work. And I would just like to thank you so much for your time today.
Thank you. Thank you so much, Robin. Thank you all for your time.